Hello. Welcome back to You Own Your Health. Today we are going to talk about adult congenital heart disease. It's a heart condition that is present at birth and affects millions of adults around the world. Many people don't realize that congenital heart disease can affect them throughout their lives. So, let's dive in and learn more about ACHD. What is adult congenital heart disease? Adult congenital heart disease (ACHD) is a term used to describe a range of heart conditions that are present at birth but have not been treated during childhood. These conditions can include structural defects, such as holes in the heart or abnormal heart valves, as well as defects in the electrical system that controls the heartbeat. ACHD affects millions of adults around the world and can vary in severity and complexity. Types of ACHD include atrial septal defect (ASD). This is a hole in the wall that separates the upper two chambers of the heart. It can cause blood to flow from the left atrium to the right atrium, which can cause enlargement of the right side of the heart. Ventricular septal defect (VSD). This is a hole in the wall that separates the lower two chambers of the heart. It can cause blood to flow from the left ventricle to the right ventricle, which can cause enlargement of the right side of the heart. Tetralogy of Fallot. This is a combination of four heart defects that occur together, including a hole between the ventricles, an obstruction of blood flow from the right ventricle to the lungs, an overriding aorta, and thickening of the right ventricle. Pulmonary stenosis. This is a narrowing of the pulmonary valve, which can obstruct blood flow from the right ventricle to the lungs. Please like and subscribe to our channel and click bell icon to get more health updates. Symptoms of ACHD. The symptoms of adult congenital heart disease (ACHD) can vary depending on the type and severity of the defect. Here are some of the common symptoms of ACHD. Shortness of breath, especially during physical activity. Fatigue or weakness. Chest pain or discomfort. Palpitations or a rapid or irregular heartbeat. Fainting or dizziness. Swelling in the legs, ankles, or feet. Cyanosis, or a bluish tint to the skin and lips, indicating a lack of oxygen in the blood. Diagnosis. Diagnosis of adult congenital heart disease typically involves a combination of medical history, physical examination, and imaging tests. Medical history. The medical history of the patient can provide valuable information about any previous diagnoses or treatments related to their heart condition. The doctor may also ask about any symptoms the patient is experiencing, such as chest pain, shortness of breath, or fatigue. Imaging tests. Imaging tests are used to visualize the heart and its structures. Common imaging tests used in the diagnosis of ACHD include echocardiography, electrocardiography (ECG), chest X-rays, cardiac MRI, and cardiac CT scans. ECG is a simple test that records the electrical activity of the heart. This test can help diagnose abnormal heart rhythms and other heart conditions. Chest X-rays can show the size and shape of the heart and any abnormalities in the lungs or other organs that may be related to the heart condition. Cardiac MRI and cardiac CT scans can provide detailed images of the heart and its structures, allowing doctors to diagnose ACHD and determine the severity of the condition. In some cases, additional tests may be required, such as a cardiac catheterization or a stress test, to help diagnose ACHD and determine the best treatment plan. Living with ACHD. Living with adult congenital heart disease can be challenging, but it is possible to lead a full and active life with proper care and management. Here are some tips for living with ACHD. Follow your treatment plan. It is important to work closely with your healthcare team and follow your individualized treatment plan. This may involve taking medications, making lifestyle changes, and attending regular follow-up appointments. Stay active. Regular exercise is important for maintaining heart health and overall well-being. However, it is important to talk to your healthcare team before starting any new exercise program. Eat a healthy diet. Eating a healthy, balanced diet can help maintain heart health and prevent complications. This may include eating plenty of fruits and vegetables, whole grains, lean proteins, and healthy fats. Avoid tobacco products. Smoking and other tobacco products can increase the risk of heart disease and other health problems. It is important to avoid these products and seek help quitting if necessary. Seek support. Living with ACHD can be challenging, so it is important to seek support from friends, family, and healthcare professionals. Joining a support group can also be helpful for connecting with others who understand what you are going through. Thanks for watching. Did you find the information helpful? What else would you like to learn about ACHD? We would love to hear your thoughts in the comments section. If you found it helpful, make sure to hit the subscribe button so you don't miss any future videos.